We are breaking into programming right now. Governor Evers is updating us on the coronavirus response. Let's listen in.
Here before, taking our lab capacity from the ability to perform 0 COVID-19 tests in early March to nearly 14,000 tests per day now is one of our success stories here in Wisconsin. We made great progress in expanding our testing capacity these last few weeks, and now we're taking the next step to help connect Wisconsinites to testing sites in their communities. Everyone in the state who needs a test should be tested. And through the Badger Bounce Back Plan, we're taking a comprehensive approach to making sure that's the case. A total of 15 specimen collection teams from the Wisconsin National Guard, comprised of more than 500 citizen soldiers and airmen in total, are now operational across Wisconsin, supporting local health departments and the Wisconsin Department of Health Services effort to increase the state's COVID-19 testing capacity. The Wisconsin National Guard is assisting with testing everywhere from correctional facilities and health clinics to private businesses and community-based testing sites. Earlier this week, we announced a number of testing sites in communities throughout northwest Wisconsin, and we have since added testing sites in northeast Wisconsin and central Wisconsin. And early next week, we will be opening community testing sites in Madison and Milwaukee. Anyone who goes to one of these community testing sites will receive their test for free. If you need a test, we want you to get a test. As we continue to expand our testing utilization, I will continue to urge the federal government to do its part to prioritize our requests for materials in support of Wisconsin's public health and safety needs. Right now, the state is in pretty good shape on testing supplies, and we appreciate the support we've received from the federal government so far. But Wisconsin still needs help from the president to get additional testing supplies like swabs and reagent so that we can ensure everyone who needs a test can get one. The more we test, the more we expect to see coronavirus cases rise across Wisconsin. But there is hope for those suffering from the virus. Many hospitals are treating patients with convalescent plasma. Convalescent plasma is plasma donated by a person who has recovered from the virus. It's currently given to high-risk hospitalized patients or those in life-threatening stages of the disease. The plasma treatment is approved by the FDA as an investigational new drug. It could offer hope to the hundreds of patients who continue to be diagnosed. In the past, convalescent plasma has been used to treat H1N1 influenza, Ebola, and SARS coronavirus, and other pathogens. Versity Blood Center of Wisconsin has been providing blood products to Wisconsin hospitals for more than 70 years. They were among the first in the country to begin collecting plasma from recovered COVID-19 patients to provide that to hospitals in our state. Many hospitals are using the plasma treatment, and the studies are ongoing to better understand its effectiveness. However, the demand for plasma is now far exceeding the number of donations. I strongly encourage recovered patients to donate plasma to help others. You fully understand the help and treatment you received to bring you back to health. This is your opportunity to help others, to provide a sense of hope, and perhaps a life-saving gift to someone now fighting their own battle. Recovered patients can call 1-866-702-HOPE, H-O-P-E. That's 886-702-4673. Or they can visit versity.org/COVID-19 plasma. We're all in this fight together, folks, and as we continue to wage an all-out war on the virus, we're also planning for the future. Earlier today, we released a series of publications to keep businesses informed of best practices and safety tips to keep workers, customers, and families safe while turning the dial towards reopening. These brochures include general guidelines for all businesses to follow, as well as industry-specific advice, such as for restaurants, retailers, manufacturers, professional offices, farmers, builders, hotel and motel operators, barbers, personal care services, and other fields. Wisconsin businesses have done a great job in adapting to our state's safer at home order, and that's what's been part of the huge success in flattening the curve. As we continue to turn the dial, businesses need to know how to re-engage safely so that employees and customers can feel confident when they return. The guides were developed by the Wisconsin Economic Development Corporation in consultation with the Departments of Health Services, Agriculture, Trade and Consumer Protection, and Tourism, as well as our industry experts and associations. This is actionable advice for businesses, especially small businesses, as they begin the road back to reopening. Instead of trying to go it alone to figure out the best answers to basic questions such as how to handle transactions at cash registers, what to do about merchandise that's been handled by customers, and how to set up an office using social distancing strategies, these businesses can consult advice from industry experts and health professionals to make good decisions. Some of the general advice for all businesses include making sure that employees who are sick don't come to work, curtailing business travel whenever possible, promoting telecommuting or other work-from-home arrangements, making sure employees have access to sanitizers and personal protective equipment when appropriate. The reopening of businesses around the state will continue to be guided by healthcare metrics contained in the Badger Bounce Back Plan, which include tracking new cases of COVID-19, assessing available medical resources to cope with COVID cases, and ensuring adequate testing and mitigation resources. No one is ready to move forward by getting back to our Wisconsin way of life more than I am. Because of all the sacrifices folks have made as we stay safer at home, I know we're on our way. So let's stay the course, Wisconsin. And now, before Secretary-designee Andrea Palm gives her daily update, I'd like to let you all hear directly from Ariel Tenner, an RN on the front lines of this crisis in Brown County.
Thank you, Governor Evers. My name is Ariel, and I am a nurse in Brown County. I work in a med-surg unit that, due to the novel coronavirus pandemic, has now been deemed our, quote, backup COVID unit. This means that when our primary COVID unit is full, or when it underwent construction to accommodate for the growing need, those COVID positive patients or any patients under investigation would be transferred to us. I know previous nurses have talked about the physical effects of this pandemic, so I want to now speak to the emotional ramifications of the present. There is an enormous sense of fear involved for the patient. They wonder, what does this mean for me and my family? Is there even a treatment for this? Where or when would I have been exposed? Is my illness going to get worse? If so, how bad will it get? Will I have to be on a ventilator? Can I even survive this awful disease? I know these are questions that patients ask because I have heard them all multiple times over the preceding weeks. Not only does this take a toll on the patients themselves, but it takes a toll on the nurses who are faced with such inquiries. Unfortunately, there is just so much unknown in our current state. And I'm sorry, but I honestly don't know is one of the most difficult things to tell a patient. I know for many nurses, even after we've handed off our patient assignment and clocked out, our brains don't just shut off as soon as we leave work. On our drive home or while lying in bed trying to fall asleep, your mind reflects back on the last 13 to 14 hours. You wonder, could I have done anything better or different for my patients? Did I forget anything pertinent? How will they do over the next 12 hours? Currently, a nurse not only goes home and reflects over these questions, but we now obsess over, was there any time that potentially could have been a breach in PPE or protocol while I was caring for a patient in a COVID room? Could I have committed this breach? Could I have exposed myself to COVID-19? Could I have brought the virus into my home? Can just one accidental breach be enough to infect myself and my loved ones? What can or should I do differently on my next shift? I think we as nurses worry so much about questions such as these because it's not only ourselves that we are trying to protect, but also the families that we come home to, as well as the patients for whom we will be caring on our upcoming shifts. Nurses are trying so hard to make sure that we uphold all of the appropriate precautions in the hospital setting. But unfortunately, This picture is very incomplete if those precautions are only being honored in the hospital. They need to continue beyond the hospital walls. I'm not saying everyone needs to wear PPE, but there are ways to keep our community safe. I completely understand how stressful and awful this social isolating has been. Please believe me that I know. I do, because when I'm not at the hospital, I too am home self-isolating, and it's not easy. It's been physically and mentally draining. But what I do know is exponentially worse right now is being isolated to a hospital room by yourself, or being diagnosed with a potentially life-threatening respiratory illness that can take a life at any age and for which we don't yet have definitive treatment. I can't help but think to myself, at least when I'm self-isolating, I get to be in my own home. For this reason, I feel very strongly about trying to reach out to the young and healthy populations, because it is true that these individuals may not be immensely impacted in a physical way by COVID-19 if they were to come into contact. But unfortunately, I have also seen the complete opposite. I have seen patients ventilated who are younger than me, and it is an awful, horrifying experience. I don't want to see more patients test positive, and I don't want to worry so much about my family, my friends, neighbors, myself, and my community. This is why we all need to work together. For me, that means PPE every shift. And for all of us, it means physical distancing and self-isolating. I know it's hard, and I wish it didn't have to be this way. But I've seen what this virus can do, and we need to do everything we can to keep each other safe, sane, and healthy. Thank you, and I'll send it back to Secretary-Designee Palm.
Thanks, Ariel. Good afternoon, everyone, and thank you for joining us again today. I'm going to start with our numbers today. We have 97,265 negative tests, which is an increase of 4,230. There are now 9,590 confirmed cases of COVID-19 here in Wisconsin, which is an increase of 375 cases over yesterday. Our total deaths here in Wisconsin have reached 384. We are tracking 235 facility-wide investigations across the state of Wisconsin. I start with these numbers because they tell an important story. The numbers tell us that practicing physical distancing and staying safer at home is making a difference. It is slowing the spread, saving lives, and protecting our frontline healthcare workers. But the numbers also tell us that COVID-19 is still in our communities, and there is more work to be done. As you continue the work of staying safer at home, at DHS, we are working to build the public health infrastructure necessary to actively manage this virus as we continue to turn the dial. We are hiring contact tracers. In fact, we've already sent interview invitations to 415 candidates, and we are still accepting applications. Contact tracers do the fundamental work of following up with every individual who tests positive. If you test positive, a contact tracer will call you. Please answer the phone. They will ask you questions about your symptoms, where you visited, and your recent activities. And when they follow up with those you've been in close contact with, they are not allowed to share your name or information. Contact tracing ensures that Wisconsinites who may have been exposed are informed so they can protect themselves and their loved ones by self-isolating and help us stop the spread. By answering the phone and answering these questions, you are helping your friends and neighbors stay safe. We are also doing critical work to protect our frontline healthcare workers like Ariel by extending the life of our PPE, thanks to the new Battelle decontamination system and UVA decontamination sites we have across the state. I hope you will all help us spread the word across Wisconsin. Healthcare workers need to save their N95 respirators so they can be decontaminated and safely reused. And we are increasing our testing capacity. In fact, we now have 51 active labs here in Wisconsin with a daily lab capacity of just under 14,000 COVID-19 tests. But this work can't be done alone, and testing capacity doesn't mean much if we're not running the tests. Thanks to our partnership with the Wisconsin National Guard, we are standing up more and more community testing sites across the state, and you can now find them on our DHS website at dhs.wisconsin.gov/testing. Please check back regularly, as we'll be updating the website with new locations as they become available. So, if you're experiencing any symptoms of COVID-19 or have been exposed to someone with COVID, please get tested. Just as a reminder, the symptoms include a fever of over 100.4 degrees, cough, shortness of breath or difficulty breathing, a sore throat, headache, chills, muscle aches, and a new or recent loss of taste or smell. Even if you have mild symptoms, please get a test. Wisconsin, together we are doing the work, but we're not yet done. Our mission at DHS is to protect and promote the health of all Wisconsinites, and we cannot do it without you. We have incredible partners in this effort, our healthcare workers, the Wisconsin National Guard, and you. Please continue to stay safer at home. Limit your essential trips. Practice physical distancing. And if you have symptoms or exposure, get tested. Thank you, Wisconsin, for all the work you have done and continue to do to keep each other safe.